Sore shoulder? It could be a dislocated biceps tendon. We're going to take you through exactly what that is and how we relocate it. Welcome to Dr. Kez's Chirolab. I'm Dr. Kez, Doctor of Chiropractic. Today we're here with Em, who has dislocated her biceps tendon in the gym, I believe, doing some flies.
Yeah.
So laying down on your back with a weight and extending the arm out, and it has allowed that tendon to dislocate. So what happens in a situation like this? There is a transverse ligament which runs across the bicep to hold that tendon in place. An injury like this can cause that tendon to rupture, and it allows the biceps tendon to flick across. What happens is the bicep likes to find the shortest possible distance from the two attachments, and it ends up finding its way over here into the pec somewhere. Now over time that can lead to an extremely sore shoulder. You can lose function, strength in your bicep as well, but over time it causes a whole shoulder complex which causes problems up and into the neck and can lead to some pretty significant headaches. So as soon as you've got an issue like this, it needs to be treated as quickly as you possibly can. Most important thing. So before we go ahead and do that relocation, it's important to understand what we're trying to achieve. That tendon being across here in the pec area needs to be grabbed a hold of and pulled back into the bicipital groove. So the humerus bone here has a groove where the bicep normally sits, perfectly designed to fit it. It then needs to be relocated and held into that position so that the biceps tendon doesn't flick back across to where it was. Now these times, conditions like this can be out for months or even years before we actually get a chance to take a look at them and treat them in clinic. So that tendon can be quite significantly shortened, and of course the shorter it is, the less likely it's going to want to stay in the new position that we've put it into. So the quicker you can get up onto these particular problems, the better, because the tendon hasn't had a chance to really shrink and cause us some problems. But that's what we're going to achieve when we do the drop piece adjustment on it, which we'll head to now. And now for the part that you've all been waiting for, how to relocate the bicep tendon. We'll utilise a drop piece table to assist with this adjustment. It makes it a lot faster and more comfortable. Keep in mind we're going to take a tendon, we're going to have to move it over a bone to get it to sit back in the right position. It's not the most pleasant adjustment in the world. So we get the tension of the table right, which we already have. Find the tendon. Adjust and hold. If we let go of the tendon too quickly, it tends to recoil back to where it was, so we just gradually release the pressure. And then test that it's back in the right place, which it is. Alright, now that we've adjusted the biceps tendon and it's sitting in the correct position, we've got to talk about the three things that we're trying to achieve here. So the first one is relocation, which we've just done. The second thing, which is really critically important, is that we need to reduce the inflammation to that tendon as quick as possible. So if you can imagine a tendon sitting right across here that we've just grabbed a hold of, as you've seen on the video, and we've flicked it right across back into the bicipital groove, it has to go across bones to fit into that position. So even the nature of the adjustment itself can inflame that tendon quite significantly. As we know with inflammation, when things become swollen, they become bigger in size. So imagine a small bicipital groove, I'm exaggerating here obviously, and a now enlarged tendon that's trying to sit in that groove and maintain in that position. So we're trying to then reduce the swelling in that tendon as quick as we can so that it can then slide nicely into that groove and remain in position. Keep in mind that that transverse ligament that has ruptured isn't going to spontaneously grow back again, and there's nothing even in the medical field that they would do to reattach that. It just is what it is. Over time, you will find that that tendon sitting in the correct position will be almost as strong as it was with the transverse ligament over the top of it. It would take a significant injury, similar to how you put it out in the first place, for it to go back out again. Now, it's not just gym junkies that cause these types of bicep tendon dislocations. It can occur even as simply as reaching into the back of your car and picking up your briefcase. It's usually an action that has a weight associated with it, with your arm extended away from your body. So it can happen for a number of reasons. In fact, you've dislocated yours before doing an event, monkey bars, is that right? Yeah. So it's not common, but it is certainly something that can happen in day-to-day activity as well as doing gym type activities. So reducing the inflammation. Once we've done our adjustment, we straight away do an ultrasound. Ultrasound, the sound pressure waves increase the blood flow to the area and help to sweep away those inflammatory cells, and it really makes a difference. Prior to us using ultrasound in clinical practice, we found by the time the client had got into their car, they would already feel a throb straight after the adjustment. So it's really important that we do that ultrasound. But that's not where anti-inflammatory treatment stops. We're going to send Em home now with some things that she needs to do to help speed up the process of reducing inflammation. Most common thing is ice. Icing with a particular protocol, which is 10 minutes on and 10 minutes off. We've got a link below on heat versus ice, and it goes through that protocol. It's extremely important. That will help reduce the swelling in that tendon. Again, shrink it down to size to get it to fit nicely into that groove. We also recommend 2 other things that we do at home, or get the client to do at home, and they are a trauma relief cream product. It's a natural product that has arnica and magnesium in it, which helps to relax the muscles as well as get rid of the inflammation and any bruising that's associated with that particular injury in the first place. It's a really great way that you at home can help to speed up the recovery of this particular injury and any other bruises, sprains or strains that you've got. A really great product, again, link below. We can also deal with this product from an internal perspective. We as chiropractors don't recommend non-steroidal anti-inflammatories because we can't, but we can recommend natural products. Homeopathics, we've got a trauma relief spray, which is a homeopathic product, allows us to absorb the homeopathic anti-inflammatories orally rather than going down into your stomach, like the anti-inflammatories can cause issues in your tummy. And it helps brilliantly with getting rid of all over body inflammation. So these are the key things that we use. We use the ultrasound, we get the client to go home and do ice therapy, and then we use these 2 products to be able to reduce the inflammation in the quickest possible way to get the best possible result. Now, the third thing that is really important is what you do with your shoulder after the adjustment. Initially, when that tendon is still swollen, it will not take much to get it to flick back across and over into the chest. So you need to keep your elbow by your side. We talk about pretending you've got a bit of chewing gum sticking your elbow to your side. So any activity that involves peeling that bit of chewing away, don't do it. Don't do up your bra, don't wash your hair, don't hang washing on the line. Keep that elbow by your side for 2 days. We've got to give this tendon a chance to shrink back into the right size and increase the likelihood of this adjustment taking hold. There are times when more than one adjustment needs to take place, but that's why you go back and get it checked by your chiropractor to make sure that it remains in place. But these are the key factors. If you can keep your elbow by your side, one of the other critical things is when you sleep. A lot of people sleep with their arm up and underneath their pillow. We recommend using a dressing gown cord, or one of our wonderful clients has suggested just to put your arm inside your pajama top so that you can't move it away from your side while you're sleeping, because habits at night time, you don't think about it, and you wake up and you find yourself in that position and the tendon's gone back out again. But this is only initially. Once that tendon has remained in place, it will be less and less and less likely to come back out again. So these are the critical factors that you need to think about. So if you've enjoyed watching us relocate Em's tendon, please click on the like, we really appreciate it. Consider subscribing to our channel, there's plenty of great videos coming your way. And if you've ever had an experience with a sore shoulder or a dislocated biceps tendon, let us know about it. We'd love to see your comments down below. We'd like to be able to respond. Any of the conditions that you have that you would be interested in us taking you through how we treat them, we would love to do that, because we really enjoy being a part of your therapeutic journey.